Let's talk to someone else who thinks it's not the right thing to do. Sir Graham Brady, Conservative MP, chair of the 1922 Committee of Backbench Tory MPs. Good morning to you, Sir Graham.
Good morning, Julia.
Good morning. We were told again and again by the Prime Minister there would not be a second lockdown. Only 11 days ago in the House of Commons, he said this to Sir Keir Starmer.
And I may say that it is a bit incoherent of the right honourable gentleman opposite to attack local lockdowns when he wants to plunge the whole country, back into a damaging lockdown for weeks on end, and he has no clue about how he would propose to get the country out of that.
Right, so now it's official government policy to have a damaging lockdown, Sir Graham. Why?
Well, I don't think I'm the person to ask that question, Julia. I don't think it's the right thing to do. I think the huge difference between this time and last time, back in March, is that we have the experience of a long period of lockdown to look at and to learn from. And of course, we went into that in March being told that it was for 3 weeks, that the purpose of it was very specific. It was about preventing NHS critical care capacity being overwhelmed. We knew within 3 weeks that had been achieved, but there was then mission creep, and we ended up with a 3-month lockdown, which is going to cost huge numbers of jobs, many of them already gone, thousands of people unemployed. Even in my own constituency, where unemployment has more than doubled already, and that's happening across the country. And we've seen the damaging health and mental health consequences of it as well. We know that this is one of those really difficult judgments, and I don't envy the Prime Minister this, really difficult judgment where whichever course of action you take, lockdown or don't lockdown, there are very serious consequences to it.
And yet the Prime Minister is going ahead. He's going ahead, he says, based on this doomsday scenario, 4,000 deaths a day we could be looking at. That data has already been completely debunked by the likes of Professor Carl Hennigan, we just spoke to, as a 3-week out-of-date data. And if that data had been correct, if that scenario had been correct and that computer modelling correct, we would already be at 1,000 deaths a day, and we're at 200 deaths a day. So we already know that is totally invalidated. Why do you think the Prime Minister is doing this? We're told he's a libertarian. We're told he wants to protect business, that he doesn't want to do these things. Why do you think he's doing it?
Well, all of these decisions have been taken, both last time and this time, based on modelling and projections. And we all know that you can get different projections and different modelling from different people. Sadly, what we also know is that the experience back in March, the lockdown was triggered based on very defective modelling from Neil Ferguson, who had a fairly poor track record of predicting the record and the future path of epidemics. This time we've had the graph a few weeks ago from Patrick Vallance, which he said wasn't a prediction, but was clearly presented on television as though it was a prediction, and we're nowhere near the trajectory that he was looking at there. This figure for 4,000 deaths a day, if you compare it to what I understand was the case at the peak in the spring in the United States of America, with the population 5 times or 6 times the size of ours, you saw, I think, 2,000 deaths a day at the peak of it in the spring there. So it seems intuitively very, very difficult to believe those figures. But none of that is to say that we shouldn't take this seriously. People will die as a result of this, but we need to remember that they die from other things as well. And, in a bad flu year, you might have 40 or 50,000 people dying from flu. One of the odd things in this epidemic has been that flu seems almost to have disappeared around the world because COVID-19 appears to have moved into the space that otherwise might be occupied by it.
And we don't lock down every year for a flu pandemic. You've also got concerns, right, as someone sort of on the sort of the libertarian wing of the party, of the Conservative Party, that particularly concerns about the government making such inroads into our private lives. The rules about households meeting, you can see your grandparents, visiting care homes, girlfriends and boyfriends who live in separate households, unable to meet or enjoy physical relations and the like. What are your concerns there?
Yeah, I think this is something that ought to concern people, whether they're on the libertarian wing of the Conservative Party or in any other part of the political spectrum. I find it astonishing that we've had this really profound interference in people's fundamental human rights and virtually no comment on it from people, especially from mainstream politicians. And the observation that I made in an article in the Telegraph this morning is that if this was going on in any totalitarian country in the world, if China was doing this, and actually they probably are, we would be condemning it and saying that it was an outrageous breach of fundamental human rights. We're allowing it to happen here to ourselves without comment. And, as you allude, Julia, we are telling people whether they're allowed to see their close families. We're telling people whether they are allowed to go to work and earn a living for their families and support them. And we are even telling people who they're allowed to sleep with and when. These are absolutely fundamental liberties. And whilst I'm all for people exercising responsibility and doing their bit to try to make sure we don't see an excessive spread of this virus, I also think that this is government overstepping the mark. And I simply don't believe that in a free democratic society, the government has the right to tell people who they can sleep with when this is a matter for consenting adults. And we really ought to get back to a more balanced judgment of the role of government, where we get back, I hope, to a more traditional British view, where we say that government is there to serve the people, not the other way around. And we seem to have fallen into a habit of waiting for a Downing Street press conference so that the Prime Minister can tell each of us how we live our private lives.
Okay, thank you very much indeed for joining us. You are going to be voting against those measures, Sir Graham?
I'm minded to vote against them, but I'm certainly going to be asking for a guarantee that this isn't going to be the last vote, that any renewal will be a matter for Parliament, not for government. And I want a detailed impact assessment that makes very clear what the consequences of lockdown are in terms of unemployment, in terms of businesses going bust, in terms of the non-COVID health consequences, and also the mental health consequences of doing it.
Anthony Browne is Tory MP for South Cambridgeshire. I have to say, no Labour MP wanted to come on. We don't think we don't bid for them. Labour, of course, are very fully in favour of this lockdown. They wanted it to be sooner. They reckon it would have been shorter if it had been sooner. But these things never tend up to be as long as they say they are anyway. Anthony Browne, thank you very much indeed for joining us.
Good morning.
Now, you're going to be voting for these measures on Wednesday night in the House of Commons when they come before MPs. Why do you think a second lockdown is the answer?
Well, we've tried everything else. We tried a regional lockdown. I represent a constituency, South Cambridgeshire, which has a very low rate of infection, but even there it is going up. We're now at 70 cases per 100,000, about 10 times what it was in the summer, and we've only had 2 deaths in the last 5 months, but it is growing very rapidly. But elsewhere in the country, the infections are going up far higher than we were predicting, just a few months ago. And it's absolutely right that we tried the regional approach, but clearly it's not enough. And I don't want this lockdown at all. I mean, the Prime Minister doesn't want this lockdown, but my heart is very much with Graham Brady, but my head is very much with saying, actually, we really have to do this. You can see the predictions. We've been here before. What would be unacceptable is to have people dying in corridors in hospitals.
Why do we think that would happen?
Because we can see the rapid growth in the deaths.
What rapid growth?
And deaths.
So you unlike me, you get to have a say in this. You unlike all of my listeners right now, other than I know an awful lot of MPs and ministers do listen to this show. You get to have a say on whether or not we're going to be locked in our homes again, effectively, apart from going to work and school and a bit of exercise. And lucky enough to go out to the supermarket. Lucky old us. What infection? What numbers? What evidence are you talking about that means you think, we should definitely do a second lockdown and tiers didn't work, even though they were only launched less than a few weeks ago, and therefore wouldn't have had chance to fully work anyway? Are you talking about the 4,000 days a death scenario? 4,000 deaths a day.
That is one of the. That is one of the.
Even though that's already been debunked.
you look at the number of infections, so it's gone up to about 20,000 a day, and we know that the deaths follow that. And the mortality rate of the infections come down quite a bit. It's not as severe as it was, but it's clearly the last few weeks. You look at the rise in deaths, and it's now averaging about 200 a day. And when the Chris Whitty first announced the rule of six and everything else, or the science behind that, he said the worst case scenario could be 200 deaths a day. We're already there, and it's
that was by mid-October.
And it is growing very rapidly. You just look at the charts; it's clearly growing very, very rapidly.
How rapidly? How rapid? You're someone who gets to have a say. You've clearly paid lots of attention. How rapidly do you think it's growing?
Well, the doubling rate is different in different parts of the country, but in some
nationally,
parts.
Nationally, what's the doubling rate?
For what? For deaths?
For infections or deaths?
For infections, I think it's about every 20 days at the moment.
And okay,
so
it's actually every 4 weeks, according to Cambridge University.
Not that far off. I was saying about 3 weeks. There's a whole range of different forecasts that the government published, and all of them from independent forecasters. They're not government. One of them is government forecast. The others are independent. They all show a scenario of incredibly rapidly increasing deaths over the winter months. And I used to be health correspondent at the Observer, and I covered winter flu epidemics endlessly. And they're always the NHS is always in crisis in winter. It always has been because the number of respiratory infections go up. And on top of that, we have the coronavirus, and it's clearly there will be extreme stress on the NHS, and the government had no option other than to act. And I really don't.
But it always has another option.
My heart is totally with on the Graham Brady side, as it were. But I just think the evidence is so strong that we have no option other to act. And I represent a part of the country which has a very low level of infection.
Okay,
there's a lot of annoyance
the doomsday scenario given by the Prime Minister on Saturday night said 4,000 daily deaths early next month. That same scenario, that modelling that was done 3 weeks ago, it's been updated on the 28th of October. The government didn't choose to use that updated version, despite the fact that had a far, far lower prediction. That doomsday scenario had us having 1,000 deaths a day right now, which we clearly don't. Does that not suggest to you that modelling is completely and utterly useless and should be ignored?
Well, I'm a big sceptic of modelling generally. I mean, I spent my life reporting economics as well. I know all about the weaknesses of economic forecasts, and so that is why the government had to try absolutely everything else. I mean, you mentioned Labour saying we need to go into lockdown 3 weeks ago. That would have been absolutely based on a pure faith in modelling, and I'm fully open to scepticism about the modelling. But the thing is, you look at the actual data now, you look at the charts of the deaths now, and it has been the last few weeks. It has been rising very, very rapidly, far more rapidly than I was expecting. I was very hopeful a few weeks ago that actually although infection rates has gone up, that actually the death rate would remain comparatively low and certainly lower than the last peak. But you look at what's happened the last few weeks, and it really has started rocketing up. And that's not based on forecasts, that's based on what is actually happening now.
We see rocketing up, and yet we have no greater capacity in hospitals, in ICU, or in hospital admissions than we do at this time of year, always, every year. So where is this big crisis?
What's the question?
What's the question? Where is the big crisis? If we are in the middle of this terrible second wave and we've got all these admissions, all these deaths, why do we have no greater capacity in our hospitals, ICU units, or indeed in any normal hospital bed than we normally have? Where are all these patients?
Well, the deaths are about 200 a day, but rising very, very rapidly. And it'd be irresponsible of the government to simply say, well, it's going to stay there at 200 a day, because we know that it's not. We've been through this back in the spring. And remember, when the government first announced the lockdown back in March, I think my sort of reaction was probably similar to yours, and this is an overreaction, etc. But we found that throughout the end of March and April, that the number of infections and indeed the deaths rose incredibly rapidly, up to roughly about 1,000 deaths a day at the peak. And you can see that coming.
That's because it was doubling it was doubling every 4 days at that time. It's not doubling every 4 days.
It's not doubling at that rate now. No, absolutely not. We know the R rate is far, so-called R rate, the infection rate is far lower than it was then. And
so why do you think a lockdown's the only solution? Why not, given the fact that Carl Hennigan's just been on the show explaining how actually infection rates have levelled off and are now going down in many parts of the country, and as you say, in parts of the country like yours and Devon and Cornwall, they're very, very low. Why not give the tiers more of a chance to work?
Yeah, well, they're low, but they are rising quite rapidly. As I said, in South Cambridgeshire, the infections are about 10 times what they were earlier in the summer now.
In the summer, when we barely had any infections at all?
Well, yeah, no, absolutely. I
So
mean, they
yeah.
started
So what
rising
a
slowly, and
surprise! What a surprise on the 2nd of November, there are higher rates
So
of
the reason
respiratory
why,
illness than in August. I mean, knock me down with a feather, Anthony.
well, absolutely. We know that respiratory infections get far worse in winter, and that is why we knew there was going to be a second wave, and that's why it's getting
And it
worse
happens
now. And
every
we know,
year.
oh, absolutely, it
And we
happens every
don't
year.
lock
But it
down our
happens every.
country and close
I know,
every
but
bar and
that's
restaurant and
because
business
every
place.
year in previous years we haven't had infections with the fatality rate and the infectiousness of coronavirus. And coronavirus is far more infectious than flu, and the fatality rate is multiples of that.
No,
of
it's
flu.
no, it's not.
So,
No. World Health Organization said the fatality rate of coronavirus for under 70s is below that of flu.
but the fatality rate overall for all age groups, and I certainly wouldn't be prepared to sacrifice everyone over 70 saying, well,
Well, you
devil
wouldn't,
take the
because the
hindmost. So
survival
that's
rate for
absolutely.
people over 70 is 99%.
But the fatality rate is still an awful lot higher than flu. It's many
Yes, well,
multiples
no one's saying let it rip.
Overall. So, this is just. So obviously, in
I'm so
winter,
sorry. Wait a
respiratory
minute. I'm so
infections-
sorry. We're
respiratory
about to have our
infections-
liberties ripped away from us once again for a lockdown that won't save any lives in the long run. We know that because the first one didn't, and this one won't either.
no, okay,
and you
but-
seem to express exasperation that I'm questioning this. Shouldn't we,
No, I
as all
don't. No,
all good
absolute-
citizens do, question when
Absolutely,
the
don't worry.
very
I've
modelling the
spent-
Prime Minister used on Saturday night to justify his reasoning for why we should go into lockdown has already been debunked.
I've been spending the time. Look, my heart is totally with you on this. I've spent the time questioning ministers on this. I absolutely don't want to see this. I'm naturally all in favour of preserving our liberties. But going back to the sort of philosophical point and why I'm a sort of classical liberal is people should have as much liberties as possible until it causes harm to others. And that's the difference between public health pandemic and other things that actually people's activities here can harm other individuals. And what the one thing that is really different compared to the lockdown earlier and so on, why I don't think it's going to be a repeated scenario, is we are within touching distance of a whole load of changes that will make it far, far better in spring. So you look at mass rapid testing, you look at the vaccines, we're almost there with about 11 different trials of vaccine in phase 3, 11 different vaccines. You look at the improvement in treatments, and I think this is massively underreported, that actually there's a lot of treatments coming through now that means that those people who do get it, who are vulnerable, over 70s, over 80s, are more likely to survive now than they were earlier. And we just need to keep the infections lower so that we can give all the better treatments, the mass rapid testing, the vaccines, a chance to actually get rolled out. And then we are literally within touching distance there.
Well,
and then when we come out of this, we will be able to breathe a massive sigh of relief. I'm absolutely shocked at what's happened to the economy and people losing their jobs. And I spent my adult life promoting economic growth.
We shall wait and see. We're going to have to leave it there.